The role of Barb DeGraff is being played today by Kerry Collins. Barb is up in South Lake Tahoe, and all of their electricity went out. So maybe at some portion of today's presentation, she will be able to join back in with us. But I'm going to go ahead and run you through this very first part. Welcome, everybody. Thank you for joining us. It is Thursday, May 21st. It is the 4th wedding anniversary of my youngest daughter. I just thought you should all know that. This is the Sierra Nevada Learning Community, and part 2. We welcome you today. Did my screen progress to this next slide? Okay, good. So today is part 2, which is further along the road to building family agency, community resilience, and how can technology bring agencies, services, and residents together. In this age of this pandemic, we have certainly switched to technology. It has become an everyday part of our life. We are on Zoom meetings and GoToMeetings and Microsoft Teams meetings and all kinds of technology we've had to learn to use, whether we've wanted to or not. So Barb DeGraff is our learning community facilitator for Strategies 2.0. She is not able to be with us yet. We're kind of hoping that she will join us shortly. She lives in South Lake Tahoe. If you know Barb, she is full of energy and enthusiasm for this work, and hopefully she'll be able to join us soon. My name is Kerry Collins. I'm a trainer and consultant with Strategies 2.0, and I support the Sierra Valley Learning Community as a consultant, and it's just been my real honor. Normally we would be in Jackson, and we really miss being in Jackson. We have enjoyed our visits there, and we have met many of you in person. Shane, would you like to introduce yourself?
Sure. I'm the assistant to the assistant. So I'm Kerry's assistant. But my name is Shane Meserve, also a trainer and consultant with Strategies 2.0. And yes, I wish I was in Jackson with you today, but we're staying safe at home, right? So yes, thank you so much for coming today. We really appreciate it.
Thanks, Shane. So I want to tell you a little bit about GoToTraining in case you're not familiar with it. So all of you have a little orangey red arrow, and if you click on that arrow, it will open up this toolbar. If that is bothering you, you can push on that arrow and it will minimize it. You have joined us today either by telephone or your microphone within your computer. If you join us by telephone, you will get a phone number to call. You will also get an access code and a PIN number. And it's really important that you enter the access code and the PIN number, or if you want to say something, we cannot unmute you. You all see your chat box. Some of you have already been communicating with us in the chat box, and we will be doing more of that in the presentation today. So we invite you to put any of your comments or questions that you may have in today's presentation into the chat box. You can also raise your hand, and we can unmute you if you're not self-muted, and you can ask your question live on GoToTraining. But I don't want you to worry about the sound in your backgrounds because we have muted all of you. So when you come on, you are automatically muted. So I know we're all doing this. Most of us are doing this from home. So you don't need to worry about any background noise that you might have with children or significant others or animals. We cannot hear you. We've also disabled, you will not be able to show your camera. A little bit about Strategies 2.0. We have a YouTube channel. This learning community is being recorded. I am following the learning community. Barb will be sending a follow-up email to all of you. It will have the link to the recording and also all of the materials. You do have a materials section in your tool. If you click on that little plus thing, you can see that we downloaded a lot of handouts, and today's presentation is also downloaded. But you can go into the YouTube channel to hear recordings of webinars that have been done, past learning communities, and a 4-part series on vehicles for change. We want to thank our funder, which is the Office of Child Abuse Prevention, for making this learning community possible today, and that's with the California Department of Social Services. So a little bit more about strategies.org. If you go on to strategiesca.org, you can register for free online trainings. We still have several online trainings coming up. There are a lot of webinars coming up and other learning communities, so please take the opportunity to go on. In your handouts, 1 and 1A, it tells you what the trainings and webinars that are happening between now and the end of June. Visit our resources page to find Building Community Resilience, volumes 1 and 2, Knowledge to Action Briefs, as well as other links. We do have a webinar coming up in June, on June 4th, on the Building Community Resilience Toolkit. So we invite you to join us for that. Oh yeah, Shane just posted that we're having an extra Spanish discussion on trauma-informed care on June 5th.
I mean, they're all exciting, but that one is particularly cool. And so it's one of our first forays into doing an event in Spanish. So just wanted to encourage.
Yes, we want to encourage that people to join in on that. And then, please subscribe to the Strategies 2.0 YouTube channel. I told my grandson I'm a YouTube star because I facilitate the statewide webinars. So you will see me and hear my voice on the webinars. So we're going to do our first poll for today, and Shane's going to launch that poll for us. We want you to please select the type of organization that you work for. If you have a problem getting into the poll, if you minimize your screen, that we have found that helps. If you cannot get into the poll, don't worry about it. Just put your answer into the chat box. So are you with a, let's see if I can see the poll. I cannot see the poll. Are you with a Family Resource Center or an FRC network, First Five, or Child Abuse Prevention Council, other community-based nonprofit, county agency or school district, or a statewide agency? And Shane, for some reason, I am not able to see any of this, so I'm going to have you go ahead and run this for me.
You're going to have to trust me?
I am.
Okay.
Totally.
Yes, and if you're having trouble seeing answering the poll, you can always put your answer in the chat box as well. We have about 60% of you have voted, so we'll give you another minute or so. Ooh, where would tribal TANF fall under?
Ooh, very good.
Probably statewide, I would guess. I don't know the answer to that.
Maybe not. Other community-based nonprofit. Yeah, if you don't see yourself reflected in this, just go ahead and put in the chat box what organization you're representing today.
All right, so it'll take about 15 seconds. Yeah, I'm guessing you're statewide agency.
Yeah, not a nonprofit.
Even though it doesn't say tribal in that little description, but I'm guessing you're statewide.
Right.
So let's do 5, 4, 3, 2, 1. I'm going to close it, and then we'll see your answers. So we have almost half of you are county agency or school district. Excellent. We have 33% other community-based nonprofit. If you could put the name of your agency in the chat box, that would be great. And then we have 7% each of you are with an FRC or an FRC network, a First Five or a CAPC, or a statewide agency. Great. And then let's see, Pat Porto says public nonprofit. Public nonprofit. We have Mono County Office of Ed. Yay, Mono County.
We love you, Mono County.
I know, we didn't get to do our trip this spring. I was so bummed.
Oh, Atco, we came and did training for you. We love you too. And Owens Valley, we love you. Oh, we miss you guys.
I know, Owens Valley, we've done a lot of training with, so yeah, we miss y'all.
We've got Children's
That's
Bureau.
right, Darrell is one of our compatriots at Children's Bureau. Yay. All right.
So go ahead and hide that, and then we'll get back. Perfect. So let's see. So we have another polling question where we want you to please select the title that best fits your current role. So are you an organizational leader? Are you staff working with families? Are you a board member or other volunteer position, a capacity builder? Or are you a constituent, meaning that you are somebody who is receiving services, client, resident, community member, program participant? If you don't see yourself represented in there, or if you're having problem getting into the poll, just put your answer in the chat box. I hope I'm doing Barb proud by taking her role this morning. Oh.
Great, we have about 60% of you again.
Hi, Pat. Have we met, Pat? Your name sounds familiar to me.
Well, his last name is Porto, which is the bag of food you always see at the Burbank airport. It's from Porto's.
Yeah.
That's why it sounds familiar to me. Oh yeah, see, he knows. He or she, sorry, Pat. I'm assuming you're gender, but I could be wrong. Okay, let's see. We'll give you about 10 more seconds. See, I'm distracted by wanting to say hi to everyone.
I know. It's nice to not have so many people on that we can be a little bit more personal today.
All right, so 5, 4, 3, 2, 1.
All right.
So we have 75% of you are directly working with families. And then we have 13% each of leaders, organizational leaders, and capacity builders. Awesome.
Great. We'll go ahead and hide that.
I did.
Okay. So then we have another polling question for you. And this is polling question number 3. We just want to know, how are you doing today? So kind of using these weather analogies. You know, are you sunny? Are you feeling good? Able to find some pleasurable moments? Are you able to balance work and life? Do you feel like you have some good support systems? Are you feeling partly cloudy? Whoops, let me get back to where I need to be. Meaning you kind of go in and out of periods of feeling good, maybe periods of worry and stress. You struggle at times to manage those feelings of anxiety and sadness. You know, you're still trying to focus on work and home. Your coping strategies usually work, but not always. Are you feeling windy with periods of rain? Mostly feeling stress, hard to find periods of peace or pleasure. Feeling mostly oppressed or challenged, trouble with concentrating on work. Have to work hard to find balance and use coping strategies. Or are you thunderstorms with lightning? Are you very stressed, anxious, and or depressed? Is it hard to focus on work? Home is challenging too. Coping strategies are ineffective, feeling isolated or hopeless. Hope we don't have too many of you in that category.
Okay, so we'll take about 10 more seconds. So 5, 4, 3, 2, 1. So great. So most of us are in one or the categories 1 or 2. Oh, you happy people, all you sunny, happy people, feeling good, able to take pleasurable moments. I love it. Then there's the second category, which is partly cloudy, going in and out of periods of feeling good. So most of us are in that category. We do have a few friends who are feeling pretty stressed.
Yeah.
Yeah.
Not surprised. Do we have some chat box responses too?
Pat says he's a 1. I'm sorry, I keep saying he or she. I'm not sure which one it is, so I apologize. But sometimes doesn't feel productive, having a hard time staying productive. Yeah.
Yeah. Well, thank you for participating in that. Really appreciate it. So what do you do for self-care? So using the chat box, share your strategies to stay positive, motivated, and focused during this COVID-19 pandemic. I'm hoping to gain some great ideas from all of you. What are your strategies that you use to stay positive, motivated, and focused?
Mm-hmm. Good. We have time in nature. Great. Yeah, I mentioned walking. My husband and I love to walk at the beach in Ventura, so that really helps me stay sane for sure. Oh, yay, we've got hikers. Kelsey's a hiker in the mountains, weekly Zoom, family and friends meetings, and exercise. Exercise, Kerry. Exercise makes her feel better. Can you imagine?
On purpose.
Kerry makes fun of me because I actually exercise on purpose. So she makes fun of me for that. So I'm pretending like the rest of you aren't here and just talking to Kerry. Is that okay? Just for a second. Erin says time with her puppy dogs. Madison says journaling. Excellent. Stephanie says exercise and time with my immediate family in my home. Monica says walks around the neighborhood and bike rides. Yep, absolutely. Marty says treadmill, and I exercise. Oh, good, yay! Marty exercises on purpose too. I'm a bar person. I love the bar classes. That's my fave. I do those a couple times a week. Darrell says I have a great time in prayer, connecting with friends on Zoom, walking, and watching comedy on YouTube. Yes, excellent.
Yeah.
And Michaela says nature and prayer. Yes, great.
Yeah. Yeah. Thank you all for sharing what you're doing. I love bath bombs, and I actually have a connection. I have a dealer, so to speak, kind of an extended family member that has her own little store where she sells all kinds of bath and beauty things, and so she will deliver the bath bombs right to my house. I don't even have to go outside. So I love to take a bath with a bath bomb. All right, so moving ahead.
Pat posted,
oh, go ahead.
She shrinks her daily expectations to what she can accomplish in 10 minutes and 1 hour. Walk away from your computer for a few minutes every hour. Smart.
Yeah. Yes. I totally set boundaries at this time when you're working at home. I think it's really important to have boundaries, and as to what time you turn on your computer, and then to make sure that you actually turn it off and leave work at work until the next day. So what we will do today is we will start and end on time. You will notice that we're already doing some good participation in polls, chats. Raise your hand to ask questions, practice self-care, whatever that looks like for you. We cannot see you, so your cameras are not on. So if you need to get up and stretch or whatever, go grab that extra cup of coffee, whatever you need to do. We don't even know what's in your cup of coffee. I can say what's in my cup. You don't really know. So whatever your self-care looks like, please do that today. Our objectives for this two-part learning community is to identify barriers to using technology in rural settings, what is on the horizon to increase access, including funding streams, learn practical application. I gotta push my screen bar down here. Learn practical application of technology to services such as behavioral and other healthcare, how this can reduce isolation and enhance collaboration. Highlight technology-based programs that can be tailored to a specific issue or challenge. Today, we're going to, actually not today, learn how homeless management, that was the last one, can facilitate agency. Today, we're in part 2. So today, we're going to learn about our voice, citizen science for health equity. The top 4 objectives is what we did at our last learning community last week. If you were not able to attend, it is recorded and on the Strategies YouTube channel. Today, we're going to talk about our voice, citizen science for health equity, a program that supports community members in collecting and using their own data to build healthier communities. So today we're going to kind of give you an update on Strategies 2.0, introductory polls, presentations in time for reflection, wrap up and adjourn between 11:30 and noon. We might be a little bit off because we like to take a lot of time to greet everybody. So I think I just want to tell you right now, these are our practice methods, which we're kind of using all of these. We're talking about well-being services, civic engagement, growth and development, community development. At the end of today's presentation, I'll tell you a little bit about what's happening with Strategies 2.0. Here's just a little bit from our highlights of part 1. You do have handouts 2, 3, and 4 are highlights from the last learning community, and some, I just totally lost what these are called, some links that you could go on to for some more information. So here we're going to do one more poll, poll number 4, before I turn this over to Anne. Did you have a chance to practice using the discovery tool? So your answer is either yes, no, or what is a discovery pool? So Shane will launch that poll for us. And if you did not, go ahead and put it in the chat box. Just so that you know, I did do it, but I was unable to upload it. So I don't know if anybody else had a problem with that too. We can talk about that later. Let's see how y'all doing on this. Oh, we have mostly no. Oh, doesn't support apps. Yeah, I get that.
Okay, so give you about 15 more seconds. And we'll go 5, 4, 3, 2, and 1. Okay, so 80% of us didn't have a chance, and 20% said, what is a discovery tool? So we can't wait to find out.
Yeah, we'll be learning more about that. Okay, well, I think you'll enjoy it when I turn this over to Anne. So let me introduce Anne. I did not ask you how to say your last name, Banchoff or Banchoff? I don't know. Normally I ask ahead of time. Yes. She's the director. What? I'm sorry, Anne. What is it?
Banchoff.
Banchoff. The director of community engagement at Stanford, and the here, let me click this closed here. I can't see my screen. The Our Voice initiative. So with that, I am going to make Anne the presenter, and she's going to take over. So let me click on you, make you the presenter, and then you can take over.
All right.
Beautiful, Anne.
So, hi, everybody. Trying to make myself go away here. People can see me. Okay. Hi, I'm really very glad to be with you today. Barb shared with me the list of participants in this call, and I just looking at the list made me excited. And in the polling, you can see what each other are doing. Such important work in your communities. Um, my background is in social work and public health. I've done a lot of work in communities, especially with immigrant communities, in clinics and hospital settings, and also out in community centers, schools. And I teach citizenship classes. And I try to get out there, even though I work at what an elite educational institution, academic institution. The community piece is the most important thing to me. And in fact, we are a research shop. We're trying to look at how communities change when community members get involved. But so I talk with researchers and folks who want to be community engaged as researchers. But for me, the most important part of my work is helping Stanford to be community responsive, to be a better community member itself, and to support programs that are truly meaningful to community. And I'm a big believer that as much as we value research, I'm a big believer that real knowledge, and really oftentimes the most important kinds of knowledge, come from within communities. So we can't just go with our great ideas about what needs to happen. We need to be listening to the reality for communities and figure out ways to be responsive. So I've been doing that kind of work for a lot of the last 20 years, in addition to my own community engagement work. And that's what I'm going to talk about with you today. I wanted to share that that was a very nice question that you asked people about self-care and how folks are feeling. It's been a tough time, I know, for everybody, lots of adjustments, and it's great to see that people are staying positive. My theory about that is that most of you are able to stay pretty positive because you're doing work that is so important. But I thought I would tell you, if you're watching me, that what's happening in my household, where I have 3 daughters who would rather not be home. One's a college junior and 2 are high school seniors who are sorry to miss all of their senior year events. But they've reverted to, they'll get along, everything's fine, but they've reverted to their arts and crafts days, which I think is funny because they were never really big into arts and crafts. And I got the henna gone crazy on my hand, and the friendship bracelet. And anyway, if you see me touching my face, which I'm not even supposed to be doing, it's not that I have a strange affliction. It's just arts and crafts gone mad in my house. So before I go on, since I'm just talking to a screen and can't see anybody, I just want to have somebody tell me that you can hear me and I'm not talking into a void.
Yep, we can hear you, Anne. No problem.
Okay. All right. So I'm going to talk about a very small initiative that we run out of the Prevention Research Center at Stanford. It's called Our Voice. And let's see. I'll tell you how it works and what kinds of results we've seen, and then I'll tell you about a little invitation we have if people are interested. So you all know, because you're doing frontline critical community work, that in the medical model we talk about death and causes of death, diseases. But a lot of what causes death relates to risky behaviors. This is a little bit blurry, and I'm sorry, but we think about smoking and poor nutrition and poor physical activity and violence and other things that are behavioral. And the healthcare community has gotten better at talking about those things. In fact, we love talking about people needing to change their individual behaviors. But we know as community people that living conditions, the physical, social, economic and service environments that we all live in impact our health profoundly. They impact our ability to adopt healthy behaviors and lead healthy lives. But still, it's hard in, it's easier to focus on what we as individuals need to do, and a lot more complicated to talk about these community level changes that need to happen for people to be able to lead healthier lives. So the idea of health equity, we think of this as a health equity initiative. Health equity is about really those unequal economic and social conditions that exist at the community level, and they're unfair and unjust, and that's because they're avoidable. They're not genetically programmed. These are differences at a community level that are changeable. And so to do that kind of work, we really need to widen our lens as researchers, as practitioners, as policymakers. All of us need to be thinking about how can we really change, creatively get at and change in sustainable ways those conditions that people live in: education, housing, jobs, social inclusion, all kinds of things. So one way, the way that we're doing it, or trying to get at that complex issue with the Our Voice initiative, is through something that's called citizen science, or community science. I think the word citizen, unfortunately, is a tricky term in a lot of communities, and so I like to think about it as community science as well. But citizen science is a more commonly used term, so I will refer to that. Citizen science goes way back, and that's about community members going out and collecting data and giving it to policymakers. So I guess Thomas Jefferson, one of the founding fathers, would tell people to go out and help collect data on what was happening in the environment and bring it back to him and to policymakers. For us, though, citizen science is a way of ensuring that that lens is widened and that the voices of people in communities, ordinary people, are heard and incorporated into efforts to improve community health. So again, getting away from, we know what's best for you, you need to do this, this, and this. We want to be able to really understand what's happening at the community level. So citizen or community science often is, people think about the for the people type is just when we're willing to share our data. Yeah, sure, we'll give you blood samples so you can do studies or that sort of thing. Citizen science with the people is where community members are gathering data, maybe about frog migration or about plant life. Oftentimes it's ecological kinds of data, pollution, noise pollution, those kinds of things that community members will gather and then share with researchers, so that the researchers will have a big database and they can draw conclusions, etc. But we think of Our Voice as our project, Our Voice, by the people, citizen science, where community members are actually doing the data. They're doing the data collection, but they own the data. They're not just collecting data for other people to draw conclusions, that community members are collecting data that's meaningful to them and using it, sort of doing their own analysis, figuring out what's important, and using the data to make changes that are relevant to their local community. So we'll talk specifically about what that means. If you've heard about or participated in community-based participatory research, it's a lot like that, but with this extra twist where we try to the greatest extent possible to have community members actually owning the data and being the primary researchers. So how does it work? So generally we have, I'll tell you about our projects and what the results have been, and we've worked all over the place. But what we do generally is train and support local facilitators, so people like you, to run Our Voice projects. So we're not running around training and doing them ourselves. We remote train people to run things locally. And the idea is that community members will be activated as data collectors, information collectors, but also as agents of change in their own community. So the 4 steps generally that are locally tailored, depending on the project, the 4 steps are that folks go out and gather information about their communities using an app, which I'll tell you about, and then they analyze their own findings. They decide together what their collective data means. That, you know, they're not just, as I said, they're not just shipping it off to others. And then they decide how they want to use their data to drive changes that they think are important. It's a very solution-oriented approach, and I like the slide that Kerry was showing earlier about 20% problem and 80% solution. This is a very solution-oriented approach, and I'll just make note here. We were talking yesterday with my team about these pictures that we need to replace some of these with Zoom screenshots or something, because we're not doing this kind of gathering anymore, but we are starting to support projects remotely, and I'll touch on that later too. So the gateway to the whole Our Voice process is this very simple app. I know I'm sure all of you have used apps of one kind or another. The Discovery tool, which some of you had never heard of before now, is a really simple app that community members can use to document parts of their community that help or hinder their ability to lead healthy lives, adopt those healthy behaviors, right? So we can tell people go out and exercise, but what makes it easy or hard to exercise or walk around your neighborhood? What makes it easy or hard to walk to school or bike to school, those kinds of things. And so people have used it who have really low tech literacy. Our first projects were with older adults, many of whom had never used a tablet of any kind, but we've kept it really simple and easy to use. I hope you'll have a chance to try it out at some point soon. We ask people to they take photos. The photos are geotagged, and then it's a little hard to see here, but you can either audio record comments about what you're seeing, or you can put in text about what you're seeing, and then you can rate as positive, is this a good or bad thing for the community? So instead of me, Anne, looking at the picture and saying, oh, that's a tree, that's kind of nice, actually, we get to hear why the person took the picture, see why the person took the picture, and then have them do a rating. Is this a good thing or a bad thing? We don't only want people to use the app to complain about things. We want people to also capture assets and strengths in their community. So maybe this would be a positive thing. Oh, there's more greenery. Or maybe it would be a negative thing. You know, this is overgrown and nobody's maintaining it, and we've lost visibility and sense of safety. We don't know from looking at the photo, but the app user can tell us. So that's essentially the entire function of the app. And I'll show you what the data look like when they come through. But just quickly, what happens after the app is that folks gather together, they share their photos and stories together. It's not, Anne, here's your data, Kerry, there's your data. It's actually a group, kind of a collective storytelling process where everybody looks at everybody's data, and then they build consensus around areas that are realistic but important to change. And again, I'll give you some examples. Then they can decide how to share their data. So here's over here in this picture in Australia, there are folks going through the photos and the data that they've collected as a group, and then they're grouping them. They're just taping things on the wall and talking about what they're noticing, what are some of the good things, what are some of the bad things, and then moving from that discussion into the kind of solution generation, recommendation generation. Who do we need to talk to make these changes? And then formulating action steps. this is a walk map that some older adults in Israel decided to make. That was their action step, that they were going to make a senior-friendly walking map, because there were areas that felt much more safe to them once they gathered their data. And so I'll show you that again later. So here's what the data look like when we have a portal, and facilitators can log in and see what their community members have gathered. You can see a walk map, you can see thumbnails of the photos, and then you can open up each photo. And I love showing this one because this thing, you'd think this would be good, right? Oh, this is nice, it's a great crosswalk, but it was rated as bad. And that's because you can see there's a crosswalk, but the crosswalk leads into a ditch. So people don't use it, or they end up in a muddy ditch. So it's just a good example of how somebody in that community knows this is an issue, recognizes it's an issue, but hasn't really thought about, well, maybe that's something we ought to try to change. Here's a good photo, positively rated photo, just about a new pedestrian bridge. But it does also note that nothing's on the other side of the bridge. Here's a very common issue in our walkability projects is blocked sidewalks, so people with strollers or mobility challenges can't get by. And again, those are things that we live with all the time, but we don't always think about that's something that maybe we could work together to change. So when people use the tool, they often start seeing these things in different ways. And when they talk about it with their neighbors who've also collected information, they start feeling like, yeah, maybe we should go talk to that construction company about changing that. Okay, so I'm going to talk a little bit about some of our early projects, but are there any questions that are coming through at this point? I don't want to just keep babbling. There are questions about any of this.
No questions so far, Anne.
Okay. All right. So
Anne, this is Kerry. I wanted to mention, because I went out and did this, that it's so interesting to me because I live on a beautiful street-lined street. But when I went out on my walk, because of the roots of the trees, the sidewalks are lifted. So that's what I had taken pictures of. So even though if you were standing back looking down my street, you would say, oh, this is a beautiful street. But as far as walking on the sidewalks, you really have to pay attention because they're all lifted because of the roots of those beautiful trees. So I think that was the kind of thing that you were talking about, right? That was what you were trying to get us to collect, is that type of thing.
Yeah, well, I know Barb sent out an invitation to folks about inviting them to try out the discovery tool, whether or not people got the invitation or were able to try it out or download the tool. After this training, I would love to encourage people to take walks with the tool and see how it works, and answer any questions that come up in that process. I will say, you had some issues with the upload, and that is partly because we're working on our server at the moment, so a bit of bad timing and those technical glitches that we're used to, but it's not a 100% perfect and flawless process, so we do troubleshoot those things constantly. But I'll tell you about some of the projects that have been successful in California and around the world using this approach. And one of the very first one was with residents of senior affordable housing sites in this Redwood City, East Palo Alto area, where folks who were at risk for diabetes, it originally started out as a behavioral intervention, but then people were talking about how hard it was to actually adopt healthy behaviors. So that's where the project originally was conceived, and older adults went out, collected data, and then organized their data to advocate for changes. And the city council and planning committees made changes and allocated some funds for sidewalk improvement and that sort of thing. So some of the project successes They repaired streets and sidewalks. They, not the people who collected the data, but the folks who should be doing that work, Public Works, and the city council allocated some funds for it. They improved access to the senior center, so cleaned some things up and made the entrance easier. The seniors realized they wanted more access to healthy food, so they developed a senior community garden. They also asked people to help teach them how to cook more creatively with the kinds of vegetables they were cooking. And we do these little pre-post tests that just talk about how you feel about your community. And folks who participated really felt a new sense of social cohesion and closeness with their fellow community members. So, and then there was the funding that the city appropriated for new analysis about these kinds of environmental factors. We had another project in North Fair Oaks. This is also in the Redwood City area among Latinos. And this was a really interesting project because it was kind of an intergenerational project with adolescents and adults. And this was one of the studies where we looked at those pre-post measures around how people felt about their neighborhood, and people just being involved in the project changed people's sense of how close-knit the neighborhood is, how much they can affect decisions or influence decisions that affect their community, and how much working together folks can influence their decisions. So very quickly through a small project, people were getting a new sense about their own ability to be part of positive change in their communities. So just quickly, I'll tell you the kinds of partners we've worked with. We've worked with grassroots organizations. Girl Trek is maybe some of you know about Girl Trek. It's a national organization with local chapters and walking groups that are all led by community members. And we remotely trained 8 walk leaders and advocacy leaders in 8 different cities. And then they did walkability assessments and then advocated for the changes that were going to be relevant and impactful in their own communities. These pictures over here are from Denver, a project in Denver where a grandma who had never really been politically involved before in her community really took up and became an incredible leader. And in these pictures, she took a second walk after the original Discovery Tool walk and brought policemen and public works folks and city council members with her on the walk to show what had been discovered in real time. And she's still doing amazing work there. We've worked with local public health departments on a safe routes to school projects and food access projects. The Safe Routes to School project, I think I saw that some of you work on Safe Routes to School programs. So we have them statewide. I believe it's in every county. And so there are sort of standard ways of doing the assessments around Safe Routes to School, but we did a test that was sort of a little bit of a controlled study looking at the regular Safe Routes to School assessments, and then comparing it with Safe Routes to School that used the Our Voice Discovery Tool assessments. And the Our Voice approach seemed to generate more enthusiasm. People got more engaged. There were more activities. And in the end, kids actually, for the whole year, were biking and walking more in the school where they had the Our Voice approach as opposed to just the Safe Routes to School alone. So, that was a small study, but it suggests that that changes really are impactful when people get involved in these ways. And then in San Mateo, this is we've started to try to look at these ripple effects. What I love about the San Mateo project, the Feast project, was that it was focused on food environment and food access. But after this group of older adults got engaged in the food access work, they asked for additional advocacy training. They really got into this idea that they had a voice, and they started going as a group. They formed a senior advocacy team And I believe even now, a number of them still go once a year up to Sacramento on lobby day for affordable housing. So it's not necessarily related to the original project idea, but somehow it shifted their own sense of what was possible and the importance of their engagement, their civic engagement. So that was a great project. We've worked with AARP on a couple of projects, walkability and access projects, and we're doing some more work even now with affordable housing groups, and really trying to look at what is the long-term impact when people get engaged in this way. Do they actually change not just their built environment, but their own behaviors? Do the community level behaviors change? Are we helping to get at health equity and make environments healthier for everybody, which is the foundational idea. Beyond the US, we have projects all over the world, and I think the reason for this is partly we try to make it really easy, and we do everything remotely. Unfortunately, I haven't been able to, even in the pre-COVID era, I wasn't traveling to any of these lovely places, but we've really tried to keep it streamlined to support projects happening on the ground and run by people who are embedded in and working with those communities, as opposed to Anne Banchoff showing up with her great ideas and training and thinking that I can lead a change process in Nigeria or Sweden or Colombia. And the other reason I think it's been so attractive around the world is because everybody who does community work, and certainly in public health and social welfare, education, the kinds of work that you are all involved in, we all want our work to be informed by and responsive to the people in our communities. That's something that we share, but we don't always have great ways to do it. So most of these projects all came about through word of mouth, because people would hear a presentation, or they knew somebody, a colleague in another country, who was doing work that seemed to fit into this health equity approach. So the one in Israel I mentioned briefly earlier, that was a great project early on, where these older adults, and it was it was Arab and Jewish Israelis working together in a way that apparently they hadn't done before. So coming together kind of cross-culturally and talking about their shared views of their community, and then creating their idea, once they'd done their assessment, was to create this map, which I showed earlier, which they called the Golden Path. And then after they created the map, they started talking with businesses along the route, and they started designating, this group of seniors would designate businesses as senior friendly based on their own experiences, not some outside agency coming in and checking boxes, but the community members themselves saying, this place is friendly to me, they have a bench outside in the shade, whatever it was. And this is a nice picture of the mayor of Haifa, the town where the project took place, going on an inaugural walk of the Golden Path, a route that they developed. In Mexico, we had an interesting project that was also intergenerational, and we love the intergenerational projects. And that one was interesting because the people who did the data collection found a lot of things they wanted to change, but they didn't feel like they had direct avenues to decision makers in the same way that we often can feel in the US. We don't always, but we can, right? We're fairly functioning representative democracy, at least at a local level. And so we can go to our city council meetings, and there's lots of ways for us to participate. But in Mexico, and this was near Cuernavaca, there wasn't that feeling among the folks, the community members who gathered the data. So they decided, we're not going to pursue the policy channels. We're going to form our own coalition to increase to kind of a neighborhood watch thing, and resident driven campaigns and signs about curbing and leashing dogs. A lot of people were afraid of walking outside because of stray or unleashed dogs. They had discussions about graffiti because there was interesting things that came up about graffiti as art versus graffiti as pollution, essentially. And so there was some common understanding achieved, but that was all kind of community level work as opposed to policy level work, but still had some lasting impacts. In Colombia, work was done to increase activity in participation in public events in the parks. This is all, of course, in the pre-COVID era, although one of these pictures looks like they're being socially distant. So anyway, in Australia, we've had a project with at a senior center, so working with clinicians and care providers. How can we make our senior centers more accessible to older folks and their families? And how can we make the spaces outside more easily accessible so people can come and go? And then in Scotland, there's a really interesting project. There are lots of urban waterways there, canals like they have down in Venice, California, and other places, but there's a lot of them are abandoned and polluted, and areas that could be beautiful and could be gathering spots have kind of degenerated. So there's been a campaign to regenerate, but they really want to build in community perspectives and experiences about how to do that. So that's another cool project. And then this is a quote from the woman I mentioned earlier, Pam Jiner, who's one of my heroes now. She's the grandma in Denver. And you know, I find this quote really meaningful because she, you know, she says it changed her life. I think it wasn't just the discovery tool or the Our Voice process. It was her and her community and her experience going through it. But I love the idea that people can start seeing themselves differently, than feeling a sense of agency and engagement that they didn't have before through getting involved in this kind of work. So I'm almost done. Oh, sorry, is there a question?
Oh, this is Shane. I just wanted to mention that Judy Sherman, who's one of our strategies colleagues, just posted that she said this app really speaks to so many of the social determinants of health, including agency or giving power to the voices of residents, often people who are marginalized. So thank you for sharing it. And I was just curious, what was your entryway into providing this tool for all of these different projects throughout the world?
Yeah. Well, I'll just show my last slide because I think I'm almost done, and then we could talk more about it. But this was just kind of a summary of this idea. And I know this whole series has been about technology as a way of bringing agencies and services and residents together and advancing positive changes at a community level. And I think that's partly what Our Voice does, but again, the tech piece, I mean, the app is so simple and basic, but people like it and it's engaging and it allows a bit of storytelling. So I think one of the reasons that it's really effective is because it does have that app and the technology piece, but it's almost like a gateway into a really low tech piece. I mean, now we're having to facilitate on Zoom and rely more on technology, but most of our projects, almost all of them, have involved groups gathering, 8 to 10 people in a room and talking things through and looking at their data. And so I think it's giving a voice. It's getting people activated. Sorry, I lost my train of thought a little bit there. But so people are in this way can be part of the solution building. It builds better communication among community members and decision makers. We've seen a lot of decision makers, city council members and police officers, and those folks on the Denver project who went on the second walk with Pam Jiner. The decision makers themselves like it. They want to be doing good. They're in public service, civil service positions, and they want to be doing things that are meaningful to the community. And so for people to come with constructive ideas based on their own experience, as opposed to just complaining or standing up and being naysayers, they're coming with ideas based on data. That makes the job for those decision makers more satisfying. At least that's some of what we've heard. It's only anecdotal, but there's just this communication and collaboration at that level also seems to be really fulfilling for people. And then, as the, I'm sorry, I don't remember whose comment you just, Judith, I think you said, but yeah, it's improving the upstream factors that impact health behaviors and health outcomes for everyone. And that's part of the idea. It's not just about me going out and walking every day to get myself healthier. It's me thinking about how we can make our community more walkable for everybody, so everybody can get out and walk more, and it's fun. My two quick things I referred to earlier, and then I want to hear people's thoughts and questions. We have, in the COVID era, we've moved to do a little more remote facilitation where we can have discussions where you were tagging people, the group of citizen scientists decides on what the themes and tags are, and then we can live tag and group the photos, and then sort them by the tags and run little reports. So we're trying out those kinds of things that don't, so that it wouldn't require people getting together in the same physical space. We also have this new mapping thing where if you have 10 or 15 people that go out on a walk, say doing an assessment. This was in Arizona. Some ASU students actually went out and did data collection on things that were healthy or not healthy in their community. And so the green ones are the things that were good, and the red ones were the things that were bad. And then some have both, right? You could see a kid on a bike and think that's great exercise, but he's not wearing a helmet, so that's not great. So you would rate it good and bad. And you would explain that in your comments. But what this allows us to do is see, this neighborhood over here is doing pretty well. There's a lot of positive things going on. Here, this corridor is doing great. Maybe that's a place we can learn from, because over here it looks like there's a little bit more of a challenge. Several people documented problems along this road. So there are ways with our portal that we can help people to see and understand what's happening at a community level. And then the invitation that I'm happy to talk about more is we have a little form that Barb will send out. Certainly, I would love to have you all try the discovery tool. It's fun to use. It's really easy, and as long as you don't have upload problems, you can even if you do have upload problems right now, it's more the experience of using the app, because you won't be able to see the data that come into the server anyway. But I did want to show you really quickly, and I know I promised to answer questions, but we did have, this was the code that I set up for your group, and we did have somebody, I don't know who because it's anonymous, who uploaded a walk. And so this is what the walk is, and somebody out there who's watching may recognize this. But so a facilitator could go in here and say, oh, this walk, which took place in Orange County, here's the walk map. You can go in and see each walk one at a time, each photo one at a time. And then you can rotate the photo. It's not pulling up the data. I think it's too slow with all these other things going on. But you can listen to the audio if it's audio recorded. Here we go. So here you would rotate the photo and then you listen to the audio. Sometimes it auto transcribes, but you listen to the audio.
This is the only park area in the neighborhood.
Okay, so you as a facilitator, or we sometimes do this for folks, this is the only park in the neighborhood. You would enter the data. You would have to figure out how to spell neighborhood. which is always a problem for me. And then you save the transcription and you can go to the next photo, right? So after you had all your photos, oh, the other thing you can do is people are instructed not to take pictures of people. This is really about environments. We don't want any identifiable information. So it wouldn't be a good tool, for example, to be ratting people out who are not wearing masks or something like that. People have asked us about that. But say there, there was a person standing here, you could select that area for pixelation, and then you can pixelate it, and then that person won't be recognizable anymore. And but you could still use the photo. So that'll pixelate so you can see it's pixelated. So it's a little pokey right now, but I just wanted to give you a sense of kind of live, based on that one person's walk, how the data come through. And then, as I was showing you, all walk photos, say if all 20 or 30 of you took photos, we would be able to look at all the photos taken on this project code, and we'd be able to see where they were all over the state and compare where this one has a lot more negative, this one has more positive, that kind of thing. So yeah, I think we'll leave it here. Here's our joyful random clip art jumping thing, and I do have more stuff in the slides that will, just some implementation things that will be included in the slides that are posted for you all. And I am really happy to answer questions now, but also after our session. So I can now, what do I do here?
I think you're good. We're gonna, I made it back.
Barb.
And you were wonderful. Thank you so much. You sound great.
I just made you the presenter, Barb.
I know. Thank you so much.
Welcome back.
So let me just go in here and slideshow from the current side. So first of all, thank you, Anne, for a great presentation. I did utilize
questions, Barb.
Okay, I know. I just wanted to just say one thing real quick. I did utilize the tool yesterday morning, and I couldn't upload it, but it was really super easy. I heard Kerry say the same thing, and I just wanted to check, Anne, are we going to be able to utilize those same codes and continue practicing with the tool?
Sure.
Okay, great. So I would really highly recommend you download the Discovery tool. And like Anne said, because we're all in different places across the state, it doesn't matter that whether you can upload it or not, but you get that feeling of what it is like, and it gives you a good idea of what you could possibly utilize it for. But one of the big things for me was we just did it on a dog walk, and the fact that it's anonymous makes it really nice. A lot of folks in my neighborhood don't pick up after their dogs when they go to the bathroom, and it makes for walks to be not that nice sometimes, even though we're in the woods. And I thought about, I would never want to confront somebody about it, but if the whole community was utilizing a tool like this, and a lot of people made that comment, it would be a way for the community itself to speak up. And that's where it really does give that voice to the person who may be a little afraid to say, it's kind of icky for me. I walk around Tahoe and there's a lot of stuff on the ground that needs to be picked up, or a lot of dogs off leash that are not the best dogs and come running up to you. So it is a great, great tool. So anyway, Shane, you said there were some questions.
I just want to, your comment makes me want to just make a note, which is that most of our projects they're smaller groups, at least to start. We do have some bigger, bolder things going on, but smaller groups, 8 to 12, because we find if you have a specific question or specific project focus, say walkability in this particular neighborhood or food access in this particular neighborhood, that you don't need to have tons and tons of people to come to some consensus about what the issues are. So 8, 12, really 15 is almost starts to get a little unwieldy. So you can have several small groups, or you can just start with one group. It's easy to try out these projects. You don't have, it doesn't have to be a huge logistical nightmare. And the other thing is it's often just one walk. So you would just say, everybody do a walk on this Saturday afternoon, or sometime this week do a walk. But it's not, there are apps out there like Citizen Mobile and 311 where people can send, if you, in your example of the dog mess, you could send a picture to your city council person. I don't know if it's anonymous, but it would be a picture of something that was bothering you. But those channels are a little bit more in that other model of citizen science, which is just pushing data to decision makers without kind of having this gathering and consensus building piece. So I just wanted to make those distinctions.
Thanks. Shane, you said there's some questions?
Yeah, just a couple questions. Here asked, how did citizen groups reach and affect policy and decision makers?
So it's amazing what community members can do once they decide they are interested in doing something. So the other thing we try to do with the projects is keep the focus on feasible, reasonable changes, right? Because it is easy. I mean, of course, there are huge problems. There's poverty, homelessness. I mean, there are major, long-term, entrenched, very complex problems that need to be addressed urgently. But these projects tend to focus more on immediate, smaller level changes that can over time build up to be quite significant. And so when you focus and facilitate to try to get people to focus on feasible changes that are important but also reasonable in scope, then it's a little easier to get to policymakers. So if you have a bunch of people going and saying we need to eradicate homelessness right now, that's going to be a longer, kind of maybe even less empowering conversation in terms of short-term wins, right? But if you have a group say, you know what, we really need a stop sign. There have been 5 accidents and this is a blind curve and we've all noticed it and we've documented it. Who do we talk to? The process of figuring out who do you talk to about that can take a little time, but usually it's discoverable, once you know the change you want to make. Oh, we don't go to that park because it's got litter all over it and it's poorly lit. Who do we talk to? We talk to Parks and Rec. Let's go take our pictures and our documentation and our ideas to Parks and Rec. So the idea is to keep the approach to decision makers kind of as feasible solutions, and also building on assets. Again, as I mentioned, like not just having a list of complaints, but saying we love that this one park has wider paths and better lighting. Can we do something like that over here in this other park, or that kind of thing? So it doesn't involve citizen groups becoming, absolute, fully committed, full-time political activists. That's not the idea. The idea is kind of a simple, feasible set of solutions that will make a difference for the whole community, and figuring out who you need to talk to make that happen. I hope that kind of gets at your question.
Yeah, and just 2 comments. One, Darrell said she can use it for her community to help clean up the desert. So that could be a good thing. And then Michaela mentioned that we have a Healthy Kids Coalition that could use it.
Yeah, I mean, we love all ideas, and we are, we're still learning so much ourselves about what kinds of situations or approaches this could work for. I will mention in terms of the accessibility. I mean, we've had, you saw the global map. We've had projects in South Africa and Israel and rural Thailand, and the app works. It doesn't have to have, it doesn't have to have Wi-Fi, obviously, when you're using it. the challenge sometimes is to upload the data. You have to be on Wi-Fi, and we're trying to make the upload process quicker and easier. And that's what we ran into a little bit this week, I think. But yeah, I mean, the idea is that you should be able to use it anywhere, rural included, deserts included.
Even Tahoe when we don't have electricity.
Even Tahoe.
So we have the question up, the reflection question about thinking of ways to use the discovery tool in your work, and to chat some ideas that you might have. I was wondering, Anne, the mental health and well-being tag that you were talking about before, in the the COVID date, now that you're doing it remotely. What are there some ideas you can throw out in terms of mental health and well-being? That's sort of our area as well.
Yeah.
Building resilience.
Yeah. Well, so just the tags that you saw on that example were tags those were themes that were identified by the group of by the citizen scientists, the students who'd gathered the data. So we don't come up with the themes.
Okay.
The themes are established by the group. That said, we've had several projects now that are specifically focused on mental health and well-being. We had one in Alaska that was focused on social isolation for LGBTQ elders. It was very specific. What is it in this community that makes you feel, part of the community or isolated? And it was super interesting, what came up for them. Where are the places where they felt safe? Where are the places where they didn't feel safe and welcome, those kinds of things.
Okay.
We've had a project on campus about that sort of thing. And there's a lot of, I'm going to forget the term, but there's a term about outdoor spaces. Maybe someone knows it and can put it in the chat. It's bio something, spaces that promote mental health and well-being. That there's increasing recognition that outdoor spaces and physical spaces, and not necessarily outdoors, but that they can be promoting of or hindering of mental health, right? So the people at Stanford, Stanford has all this land and space, and the facilities, the grounds people were saying, we're really excited about this idea about having more space on campus that feels like the space itself promotes well-being and mental health. But what does that look like? We'd love to hear from the community members who would use it. And so we're planning when things get a little bit closer to normal to do a project around that. So I think there's a lot of possibilities.
And then we also have another question from Michaela about, do you do a pre-survey in communities to land on a project?
Yeah, you can. I mean, the thing about the specifics of a project in any given community is that it's really determined by folks like you. So if you said, I don't know where you are, Michaela, but if you said, we really want to do, we don't want to determine what the project's about. We want our community members to determine what the project's about. That's actually written in as an option in our kind of protocol for facilitation. Some people are already clear, we need to do a walkability assessment, right? Or we need to do something around park access and use.
Right.
But if you really want to just engage community members, you have a group of community members and you want to engage them in a productive community improvement project, you could talk about, we have the app, we have this approach, what should we use it for? What should we assess? And all that is really determined at the local level. We do not try to micromanage your program design. We have we want it to be focused on something related to health equity and these social and economic determinants, but that's fairly broad. We don't want it to be, let's take pictures of good places to have, I don't know, car races or something. So there are some things that don't necessarily fit in conceptually, but aside from that, We're really open to ideas, and every project's different. It's the app, when you use it, you'll see it's super generic. It just says, take a photo, so it doesn't have, it's kind of, what matters is how the project is framed. What are we doing together? What kind of information do we want to gather together? And then people do the data collection, then they do the discussion and the solution building, but it's not something that we want to dictate from Stanford. Again, you guys know better than we do about what's important and what people are thinking about and what the opportunities are for improvement, and where community engagement can really help things move in a positive direction. So we rely on you. And, if it wasn't clear, we're not going to any of these places. I mean, there are projects that we run locally that we're more involved in, that we might co-develop or co-create. But for the most part, the ideal for me is that we're completely community responsive, that people are finding us, coming to us and saying, I have a project. We've been trying to figure out what we can do to clean up the desert or get kids to school more safely, or whatever it might be. And then we help you to design a project and make it happen that works for you.
And just a reminder, so Anne created a form that we're going to, it's a link to a Google document, and I'll send that out to everybody who registered and is on or is on the call, and I'll resend out the discovery tool code that Anne created, and you can go out and play with it yourself, along with the discovery tool user guide, which is very easy. It's a 2-page, but most of it's big pictures of your cell phone. So it's very, very easy to download the app and then put in the codes and then go out and do your walk. It's extremely user-friendly. So I will send that out to everyone after this. And then if you're interested in exploring ideas with Anne, fill out the Google document, and will it go directly to you, I guess, Anne? It's got a link. They just submit it.
Yeah, and please give people my email address too, or there's a generic. And
all these, exactly. All this material is in the material section, and I'll send it out as well with your the PDF of your presentation, which has all your contact information as well.
Yeah, and I should just say we do have. We have. For a lot of our projects, we jointly fundraise with our partners, or they say, I have a budget for this. We just have to cover our costs for taking on these projects. But as I discussed with Barb, this summer, if people have projects they want to try out or do a little trial run, we can support a few of you as a special one-time offer. No, the thing is, for me, I would love to say yes to absolutely everybody who wants to do this. And with this summer, we have a little bit more of a team, because I have some summer interns who are working remotely with us. So fill out that form this week and let us know if you have an idea or something you want to try out. And we're going to support people, as many people as we can, to try it out this summer. And then we can think about, if you want to go bigger from there, we can think about together how to make that happen.
Great. Thank you, Anne. And it may not be this week, being that it's Thursday, and a lot of people, by the time I get it to folks and everything, it'll probably be a little bit, maybe next week sometime.
That's fine. I'm flexible.
You are. Thank you, Anne, so much. I just want to share a couple of things with folks before we close. Thank you, Shane and Kerry, for stepping in so beautifully when I lost electricity up here 10 minutes before we were supposed to go live. I think I'm jinxed. It's the second time this has happened. But I wanted to talk a little bit about the learning communities, because for those of you that don't know, the Learning Community Project will be ending June 30th. We've had a wonderful, wonderful 4 years. We've had wonderful learning communities, and I just want to thank everyone for your participation, your support. You've been wonderful to work with in the Sierra region. We hope that you'll build on the connections that we made. Strategies July 1st will become Strategies Technical Assistance, and our work will focus more on counties that are developing collaborative child abuse prevention plans. We won't do learning communities like these regional ones. We will be working with local counties, and in some cases, learning communities will be a part of that project. If you reach out to your local child abuse prevention center or your child welfare office, you can find out if your county is involved in the prevention planning, and if they're not, maybe give them a little encouragement to do so. I am going to be planning in June 1, maybe 2, depending on the level of interest, online meetings where I will talk with folks about what is involved in making a learning community happen in your community. So if people are interested in that, I'm going to be sending out invitations to my full mailing email list. So you'll get an invitation for that in June. So keep an eye out for that online invitation. And also the highlights and resources document will come. And if you're interested in the Our Voice project, you'll be able to take advantage of that as well. Thank you again, Anne. Thank you, Kerry and Shane. Judy, if you're on the call, thank you for all your support. It's been an honor to be a learning community facilitator for all of you, and I hope we stay in contact. And I hope you all stay very safe and very healthy as we deal with the COVID-19 pandemic. Thank you, Anne. Thank you, everybody. Take care now. We're going to be signing off.
Thank you so much.
It's been great.